Well, thank you everyone for joining us, this afternoon. Sorry, wait. Thank you everyone for joining us. So we just came out of the budget session in the Assembly. It's going to be going forward in the Senate here shortly. I think the bottom line here is this has been a difficult budget, but it's a difficult budget because of unsustainable spending that the governor and legislative Democrats have been doing over many years now. Legislative Analyst Office has warned time and time again, this is not sustainable. We're going to have big deficits, and here we are. And maybe the big takeaway today is, look, they're continuing to spend $12 billion in this budget for health care for illegal immigrants. And in order to do that, they're taking away vital payments to doctors, nurses, clinics, hospitals, who were promised greater reimbursements under Prop 35. They're robbing that promise in order to prop up $12 billion for health care for illegal immigrants. And coming down the road, because now there's still this papered over deficit, more cuts are coming, and probably for the most vulnerable here in California. Big problem. Other big glaring issue in this budget, wildfire prevention funding. Only $200 million out of the Greenhouse Gas Reduction Fund. In that same fund, they're putting $1 billion towards high-speed rail. This failed project that has all kinds of problems with it, getting called out in audit after audit, it's getting $1 billion. But wildfire prevention, stopping these catastrophic wildfires that have devastated Los Angeles, the Palisades, Altadena, Paradise, Greenville, too many communities in our state, you get $200 million to stop these wildfires. It's completely misplaced priorities. We've stood against it. We had an amendment to the budget that was very reasonable, which say, hey, eliminate that funding and let's fully fund wildfire. Let's fully fund the Prop 36 that the voters passed with 70% of the vote. Let's fully fund public safety that the voters demanded. And let's restore that money for the doctors and the nurses and the clinics who are providing the care for the most vulnerable in our state. We had that amendment. Democrats rejected it. It's very reasonable. We're going to keep standing for the right priorities here in California. We're not going to give up, and this is going to move over to the Senate. And my colleague, the budget chair in the Senate, who's been doing vice chair.
He tried
I
to
wish you were
promote
the
me.
chair. I wish you were the chair. Budget vice chair has been doing great work over there, and I'll turn it over to him for his comments.
So there are many details in this budget that are huge problems, well articulated by our Assembly Republican colleagues, as well as Leader Gallagher, and the Senate Republicans are in lockstep with the Assembly Republicans on all of these individual issues. But I have to emphasize, as I have before, that the biggest problem with this budget is that it does absolutely nothing about the structural deficit that we, in fact, have. We have existing programs that are growing faster than we know revenues can grow, and that's assuming no particular economic problems. So this budget was really passed on a hope in the Assembly. It will be passed on a hope in the Senate. That is, in fact, what senators said at a press conference the other day. They are hoping for a miracle. And so, therefore, they have rejected some of the governor's cuts in the May revise and substituted that with some borrowing, which, by the way, makes the structural deficit worse. A budget that's passed on hope is a budget that is destined for trouble, and this one is in the following budget years.
Just in time for a few questions. If I can ask your Nilo questions first for our senator, and then back to the floor, and then we'll open it up to everyone.
Members, Democrats have been saying that federal government poses the biggest risk to this budget. And just logistically looking ahead, we know that now the conversation is all about the unclosed sources parties that we left out. Your response to that fact that Republicans currently control the federal government, yet you all will be left out of the negotiation.
To blame the structural deficit on President Trump is absolutely absurd. If Kamala Harris had been elected president, we would still have the same structural deficit today that we indeed have today. That is a red herring.
There's a very simple way for legislative Democrats and the governor to get full Medicaid funding out of this new bill that we just passed out of the House. Don't fund illegal immigrant health care. That's all you have to do. And 58% of Californians have said they don't want them to in the PPIC poll, so it should be pretty easy. The voters of California don't want them to do so, and if they don't, they will get the 90% full coverage for Medicaid expansion. So the ball, again, is on their court. All they have to do to get full funding from the federal government and avoid that situation is back away from this totally flawed policy that from day one everybody said you cannot sustain Medi-Cal funding for illegal immigrants. That's all they have to do. But they are being too stubborn. They're continuing to prop this up, continue to pass loans, $3.4 billion loan, $3 billion more dollars thrown into it. Now it's a $12 billion pull on our budget. I mean, look, they're the ones that are being reckless and unsustainable in their spending. So it's a real simple way to fix the problem.
So I guess in response to that, are you saying, obviously this expansion has happened over time, there's a bunch of different groups involved. Are you saying like all undocumented Medi-Cal recipients should be included on their plans, including children and seniors?
I'm saying that we are the only state in the nation who uses Medicaid to fund health care for illegal immigrants. The only state. And this bill that just passed out of the House, all it says is you can't do that. And if you back away from that, you'll get 100% of your federal funding. So, and 58% of California voters have just said, yeah, we really don't think that's a good idea. It's not sustainable. So, of course, we're compassionate. We want to help everybody. We want to provide help to all kinds of people, but you can't do it. Right? Like you can't sustain it. When they originally said they were going to do this, they said it'd be $4 billion. It's now $12 billion in this proposed budget. How in the world can we sustain that when we got deficit budgets right now? That's the reality, and I think voters get it. That's why they're telling us very clearly what they want us to do.
I'd add to that the first cohort that was included were youth under 19 under Governor Brown, and he said that we couldn't afford any more than that, and that's why he wouldn't go any further than that. There wasn't a lot of pushback from that. The pushback came when adults were included in gradually in additional cohorts, and that's where the problem has developed, is basically from the adults that have been included in the program. The problem is it's not affordable. The numbers are more than were forecasted, and that's increasing the cost well beyond what was anticipated. I believe, as I've said before, that this is a magnet of people to the state of California to achieve medical benefits that don't exist in other states. And to the extent that that's happening, driving the costs up, as I said, we just simply can't afford it.
I mean, with all due respect, people will be undocumented whether it's back to California or health care or not. It's more a question of whether it's provided to them or not.
Again, aren't these guys talking out of both sides of their mouth when they say that? They can give someone a Medi-Cal card, but at the same time, they're not paying the doctors and the nurses and the clinics that provide the care, and they're shutting down. They are shutting down. Hospitals on the verge of closure, clinics shutting down because Medi-Cal does not pay them enough to continue to operate. So you can give somebody a Medi-Cal card, but if there's no one there to provide the care, that's not helping our communities. That's not helping our most vulnerable, right? And so, look, we can't be all things to all people, right? And so that is the fundamental issue. They're cutting Prop 35 reimbursements in this budget and undercutting those frontline healthcare providers who provide the care. And at the same time, they're propping up Medi-Cal for illegal immigrants that is just not sustainable. To me, it's just a simple fiscal issue, a policy issue that we could fix. And we could actually ensure that we have stable, sustainable health care for our most vulnerable in our state.
I think it's important to realize, first of all, that the federal government has a bigger budget problem than we have here in the state of California. significantly bigger. There's a $37 trillion debt at the federal level. So there are going to be budget impacts as they begin to address that significant deficit. It's going to take years to bring that into balance, but it's going to have an impact on budgets, and therefore it's going to have an impact on states. I don't think either Assemblyman Gallagher or I could specifically guess what those impacts are going to be, nor do we have anything to do with it.
And again, what are the significant changes to Medicaid? Actually, Medicaid's really being fully funded at the federal level. They're just saying that you won't get the 90% if you're using that money for illegal immigrants.
Well, no,
that's it.
There's also changes that are estimated to kick millions of people off their plan because they want to make stricter eligibility.
Oh, you mean like because the program was started, right, to help women and children and low-income individuals, right? So able-bodied people, right, who should be working and continuing to pay for them, like, you know, those seem to be like reasonable changes I think a lot of people actually agree with, right? But the problem is the fundamental Medicaid program is being funded. The fundamental Medicaid program is being funded. And if you want that 90% for the expansion, right, you just can't use it for illegal immigrants. So again, the ball is on California. The ball is on California's court again. You know. Look, I'm in favor of making sure that Medi-Cal is sustainable long term, right? That's what I'm in favor of, right? And now we balloon the costs. We're having to do loans and extra money going into the program that's going to bankrupt the system. We need to stabilize. That's our job. We're here in the state legislature, right? The federal government is going to do what they do, and we'll have to react to their policy, right? Whatever it is. But here at the state, we should be doing what we need to do to bring that program into sustainability so that it's there for the most vulnerable, the purpose of the program, right? For the most vulnerable in our society, the low income, women and children who need that health care.
Right. So do you support the federal changes that could mean some of those people lose their benefits and if they are citizens because they no longer are eligible?
You know, look, I support making the program solvent, period. And my focus particularly is on California and the Medi-Cal program, which right now has some serious problems, and this budget does nothing to address them.
Right. So the federal changes could also affect Medi-Cal. So I guess are you supportive of
Yeah, you should ask the Democrats. You prepared to? You should ask the Democrats. Oh, well, I'm not in the majority. I don't get to pass the budget. I certainly get to comment on it, right? And I'm not. I just told you what they did. They said 90%. No, Jeremy, they said 90% of the funding will come through. You just can't spend it on illegal immigrants, period. That's what they said.
I think it's important, again, to emphasize the federal government has a larger budget problem than we do here in the state of California. And both Medicare and Medicaid are not sustainable under current spending plans. Just about everybody agrees with that. How they solve that problem is up to the federal government. It's not up to us, but it is going to affect the state. It's not a sustainable program as it is. Again, the budget writers in Washington, D.C. are going to have to address that problem, not the budget writers in California. And I wish I was even a budget writer, by the way.
So unfortunately, Senator Neal does have
Okay.
They're starting without me.